This COVID-19 infection control and occupational health Listen to the Experts video series was produced by the CSIR. This video clip was produced in support of the South African National Department of Health in its fight to reduce the transmission and impact of COVID-19 on South Africa's healthcare sector.
Yes, my name is Mpho Ruth Molebatsi. I'm an occupational practitioner from Mpho Occupational Health and Safety based in Kimberley in the Northern Cape. The country is faced with crisis of infections and deaths among healthcare workers from coronavirus, COVID-19. For us to be able to protect and prevent this crisis, there are certain processes that we need to adhere to as healthcare workers or managers in the workplace. These are the following forms that the healthcare worker and the managers within the facilities to have an understanding on them, which is the WCL1, which notifies the occupational disease, the WCL2, which notifies the injury on duty, the WCL4, which reports the first medical report, the WCL5, which reports the final medical report. Now, when you go further into the general administrative rules, you'll find that under the clause number 9, it says it is imperative that the health and safety representatives with the employer to report all the incidences to the Department of Employment and Labor in writing. What is also important is to understand that within the occupational health and safety, there's section number 20B, which also give us an understanding the roles and responsibilities of the health and safety committees, that together with the employer, they will report all incidences, which will be the illnesses, the deaths, and even the exposure. Some of you are health and safety reps or representatives in health and safety committees and managers, not forgetting to include even the compliance officers. Now, after the exposure or after the healthcare worker has contracted COVID-19, it is important to go back and assess and investigate the challenge, which will be, we look at the controls, we look at the PPEs, and we correct the space. So, as managers and compliance officers, of course, you as health and safety representatives and committees, in line with the Department of Health guidelines, you need to disinfect. This is in order to prevent repeat incidents by temporarily closing the affected area for disinfection. What is important again is, as you as healthcare workers and managers, you need to comply by following certain rules in reporting the exposed health worker to the National Institute for Occupational Health. And that you can do through the National Guidelines of Occupational Health and Department of Health. So that would take us as to how do we look after the healthcare worker that is exposed to COVID-19 in terms of counseling and post-counseling as well, including their families. So that one would be done through contact tracing and reporting all those as stipulated by the National Department of Health guidelines. This can be done by following the links below. In conclusion, report all the incidents to the relevant authorities. Secondly, follow measures to prevent further infections. Thirdly, do contact tracing. And lastly, do provide mental health support to the healthcare workers and their families. Thank you very much.